The Our Dorset Leading and Working Differently portfolio has achieved a lot this past year. Here are some of the highlights. In April 2019, we opened the doors to the Our Dorset Development Hub in Westmoors, which has already hosted over 40 events and attracted over 1,000 visitors in total. Across Dorset, senior executives and partners have come together to explore a collaborative approach to providing housing for health and social care workers. Watch this space for new projects coming soon. The team has really grown this year, and we are proud to announce that all of the new posts have now been filled. A workforce planning offer has been launched to the system, providing 3 levels of support, including workforce planning and methodology and tools. A Dorset Workforce Intelligence Group has been established to support the automated data collection for NHS trusts and primary care. The Dorset Integrated Workforce Planning Group also plans for urgent and emergency care, dermatology, physiotherapy, cancer services, mental health and learning disabilities, primary care networks, nursing, pharmacy, frailty and paramedics. Joint careers events are now taking place across Dorset on a regular basis. We have visited over 60 schools to showcase more than 350 jobs to thousands of pupils. The recruitment website, Join Our Dorset, was launched in September 2018. It provides visitors with all the vacancies and career paths available in the NHS and social care in Dorset. Within the site, we have also launched 5 additional microsites to target specific areas. This year we took the first step in developing our social media strategy and launched the Join Our Dorset Twitter page. Growing the following has been a huge priority, and already we have more than doubled our following. However, the focus has been on quality over quantity. Despite only having a small following of 2.4% compared to one of its peers, the Join Our Dorset Twitter has managed to outperform that platform with almost twice the number of impressions and close to 3 times the level of engagement for the same post. In September 2018, we launched the Registered Nurse Degree Apprenticeship scheme and have 2 cohorts currently underway. Our Dorset agreed to £675,000 of funding to recruit 50 registered nurse degree apprenticeships throughout the system. The scheme was extremely oversubscribed. We received almost 5 times as many applications as there were places available. One of the reasons the scheme was so popular was due to the social media campaign we launched. The campaign reached over 77,000 people and had almost 500,000 impressions. In September 2018, we launched the system's first ever Trainee Nurse Associate programme for internal staff. We currently have 42 Trainee Nursing Associates. We have successfully procured more than 30 additional apprenticeships across the system, which include clinical and non-clinical roles such as cybersecurity, commis chef and plumbing and heating. The new physician programme started in January 2019 with 20 students. The second cohort is planned for 2020. In September 2018, the Primary Care Workforce Centre delivered the hugely successful Our Dorset Passport. We now have over 370 GPs registered on the system. Over 90% of Dorset practices are registered and more than 1,000 jobs have been posted on the platform. There is also a shift fill rate of over 90%. 10 GP fellowship roles have been developed across Dorset for qualified GPs. The fellowships are aligned to local needs with a mix of digital and clinical fellows focused on supporting locality and primary care. The GP coaching faculty now have 7 GP coaches who currently support 17 coachees. The faculty will soon be expanded with 6 new coaches, consisting of pharmacists, nurses, and healthcare assistants. In September 2017, we launched our shared learning events, which brings specialists from secondary and primary care together to provide education for GPs, nurses, and allied health professionals who are working in general practice. To date, we have delivered 20 events covering paediatrics, cancer, frailty, MSK and pain, diabetes, cardiology, and respiratory. The events have had over 650 attendees, and feedback from the events demonstrates an average increase of over 50% in confidence when treating patients. Walking in the Same Direction programme was launched in 71 people from multiple organisations and professions across Dorset. The 3-day workshops focus on the skills and behaviours needed to lead, influence and collaborate within an integrated care system. Some of these were for the teams such as the Allied Health Professionals Network Council, Weymouth and Portland Locality, the Rheumatology Network Board, the Sexual Health Leadership Team and Bournemouth East Locality. 22 senior leaders from across health and social care in Dorset have begun the 12-month Our Dorset Talent Programme. Delegates are supported by a coach from within the system. There are around 100 people from across the system who have joined together to complete a coaching institute and leadership and management coaching qualification. We have recently trained a further 19. These are just some of our highlights. Well done everyone!